Hey, Dr. Mashburn again. The video I thought was getting a little long, so I decided to split it up into two videos. And so we're going to continue the cranial bones. We're going to talk about, we just finished with the ethmoid bone, so now we're going to continue with the ethmoid bone. So we did the sphenoid bone, so now we're going to talk about the ethmoid bone. And if you're looking in your textbook, the ethmoid bone is this kind of gold-shaped bone right here. Okay, so this would be your ethmoid bone. So this would be your nose. And so this is not bone, this is actually cartilage. This is hyaline cartilage that forms the septum of your nose. And then behind that cartilage, you have a bone here, and then you have a bone here. And so if you're looking inside the nose, so we've removed the cartilage here, and we're looking inside the nose, this line here is called the perpendicular plate, okay? Or it's your septum. And so this line here is actually divided into two bones. So the bottom part is this bone here called the vomer, and then the top is the ethmoid bone. Now, I know that's kind of hard to see. Let's see if I can change colors a little bit. Maybe that'll help. Nope, it's kind of too dark. So again, the top half is the perpendicular plate of the ethmoid bone. The bottom is another bone called the vomer bone. You can also see the ethmoid bone here. The ethmoid bone is surrounded by the frontal bone if you're looking from the skull from the inside. So this little thing that's kind of surrounded by frontal bone, that is also your ethmoid bone. Now, some of the features of the ethmoid bone, if you're looking at it from the inside, the view of this view, this ridge is called the crista galli. Crista galli, okay, which means rooster's comb. So it looks kind of like a rooster comb, and that's what you're seeing. It's actually an attachment point to keep the brain from sloshing around up in there, so it kind of holds the brain in place. Around that, you have the cribriform plate, and that's the little space on either side of the crista galli. And it's actually perforated. It's got little holes in it, and this allows the nerves from your olfactory or your smell nerves to get down inside your nasal cavity. Okay. Again, the little line that forms the top half of the septum, that's called the perpendicular plate of the ethmoid bone. And then you have what are called turbinate bones. And so if you look inside the skull, you've got these little swirly bones here. So if you look inside, they kind of make these little swirls like that on either side, inside the nose. Again, you look in your textbook, it's a little better picture than what I've got here. And these turbinate bones, they're covered in tissue, and as you breathe in, that allows the air to be swirled and warmed. It allows the air for the little nose hairs to catch any dust and things like that before it goes down into your lungs. So when you look at these turbinate bones, you have an inferior, a medial, and a superior. The medial and superior turbinate bones are part of the ethmoid bone. Okay, so this would be your medial one and your superior one. This bottom one, your inferior one, is not part of the ethmoid bone. So again, look in your textbook, a little better picture than what I've got here. I don't have the best camera and flash sometimes to get some of these dark spaces, but you can see it again in your textbook. All right, and so then the last bone of the cranium is your temporal bone, and it's the bone here on the side. So this is one of those 3D images I have computer generated where I can isolate out the bone and show you what it looks like. And you can see it comes all the way around on the side of the head on both sides. This will be the temporal bone on the actual skull. Okay, and this is one that's been isolated out to give you an idea of what it looks like. So again, you have two temporal bones, one on either side. Now, the processes or the features that you need to know, if you look at the temporal bone and you look at this bone here, this is called your zygomatic bone. The zygomatic bone, your cheekbone, it joins the temporal bone. It makes this zygomatic arch here. So this is your zygomatic arch. Well, the back half of the zygomatic arch is formed by this process called the zygomatic process. So the zygomatic process of the temporal bone joins with your zygomatic bone to form the zygomatic arch. So that's one of your features. You have your mandibular fossa, and so if you look at the temporal bone and you see there's a little space here, there's actually a depression inside the temporal bone that allows your mandible, which is your lower jawbone, to articulate with the temporal bone. So fossa meets ditch. Okay, and I think I have a better picture of that. If you look at the underside of the of the skull, there's a little ditch here. That's your mandibular fossa, and that was where the mandible will articulate, where your lower jaw will join your head. You also have what's called the styloid process. And the styloid process is this pointy thing. Okay, so if you're looking at a skull, here's a pointy thing here. There's a pointy thing. You can't really see the one underneath there. But styloid, like a sharp pin, that's your styloid process. Also an attachment point. Anytime you see process, it means something's attaching there. And we'll cover, we'll go into more detail about all these attachment points when we talk about muscles as well. You also have a mastoid process with sinuses. So the back of the temporal bone, there's this large bump on the back of the temporal bone. If you actually feel your skull behind the ear, you can feel that large knot. That's the mastoid process, and it's got a sinus inside of it. And then you have, I'm going to skip down the jugular and carotid foramens and skip to your internal and external meatus if you're looking at your lab guide. A meatus is simply a hole, and so auditory means to hear, and so if you're looking at the skull, there's a hole on the outside. That's your external auditory meatus, and if you look inside the skull, you can find the internal auditory meatus. Okay, so let's go to another view and see if we can view the jugular foramens and carotid canals or foramen. So again, I don't have a picture of the skull. It was too dark to show you the internal auditory meatus, so you can see that in your textbook. I will tell you that I do have a picture of that using one of my computer-generated images. So I'll try to find some better images for your exam. But again, if you see a hole in the temporal bone on the inside of the skull, that would be your internal auditory meatus. Again, there's a really good one in your textbook, so you can use that as well. I'm trying not for this video to be 2 or 3 hours long. You also have the foramen for the jugular vein and the carotid artery. So if you find this little hole here, is your jugular foramen on this side. You have one over here, and then your carotid canal is just in front of that, here and here. So again, this just kind of gives you an idea of what to look for and what to study. So go through your textbook and use your images and the skull pictures. Also use PAL, because I do bring images from PAL as part of your exam as well. So you should be able to, with all those resources, identify all of these things. Now in your lab guide, it also mentions the ossicles. And these are the little ear bones inside your ear, the malleus, the incus, and the stapes. We're going to do that in more detail when we get to special senses, so you won't need to be able to identify those right now. All right, and then last but not least, I want to talk about the fetal skull. And the fetal skull has something called fontanelles. And so these fontanelles are something that we know as soft spots. And so before the child is born, you have these kind of large membrane areas connecting the skulls. And this is so that the bones can actually slide and move a little bit as the child comes through the birth canal. So it allows there to be a little flexibility in the skull as the child is being born. And so these soft spots are also called fontanelles, and you've got to be able to name those. Now if you're looking in your lab guide, the fontanelles have two ways of being identified. You can either use a direction term or a bone term. Okay, so this is your anterior fontanelle. That will be the direction term, or you can call it the frontal fontanelle. So either one, anterior or frontal fontanelle. On the back of the skull, you have your posterior fontanelle or occipital. So again, posterior or occipital. So posterior would be the direction term, occipital would be the bone term. You have your anterolateral or sphenoid. So anterolateral, so anterior, front, lateral side. So front side or near the sphenoid, so you can call it either one. Then you have your posterolateral or mastoid, so back side or near the mastoid process. So you need to be able to identify these fontanelles. You'll see an image very much like this, and you'll need to identify the fontanelles on the fetal skull. Alright, so again we've had 2 videos on the cranial bones, and then my next video is going to be on the facial bones, and I may do that as 1 or 2. We'll just see how long-winded I get, and I will see you in the next video. Thanks a lot. Bye.